So is melatonin the next vitamin D? Hey, it's Dr. Tugger, your friendly neighborhood colorectal surgeon, and we've talked a little bit about vitamin D from time to time. It's an important vitamin. The number one risk factor for mortality during the COVID pandemic was a low vitamin D. That was the one adjustable thing that you could do to lower your risk of mortality with COVID. You have no control over your age or your medical condition, but vitamin D you have control over. So, why would they ask this question? Is melatonin the next vitamin D? Well, it's an important one to ask. Vitamin D and melatonin are very, very similar. They augment each other. Vitamin D is important for bone health. Melatonin is neurotransmitter, helps you with sleep and rest and that sort of thing. And so if you are vitamin D deficient, a lot of times you are melatonin deficient. Now, I find these conversations so fascinating, like, oh, what could possibly be causing all this vitamin D deficiency and melatonin deficiency? I'm like, you just need a supplement or some other medication. Oh, looky there. Glyphosate herbicides deplete your body of both vitamin D and melatonin and are associated with not just sleep disruption, but neurodegenerative diseases, especially if you are pregnant and you're exposed to glyphosates, you have a high risk of your child having a neurodegenerative disease. There are a lot of toxins in your life around you. Just know those toxins are ubiquitous, and I don't think that you could ever truly avoid them. What you can do is minimize them. So that's why I suggest use your little scanning apps, Yucca app, or some other that talks about, oh, there's glyphosate in that. Stay away from things that are not organic. Stay away from things that are genetically modified. Personally, I feel that American derived wheat and grains in general are most likely put through a glyphosate drying process because we will find glyphosate even in organic grains, especially oats, in this country, whereas in Europe, they don't dry their grains with this substance. So know where your sources are. If you can find the farmer making these grains and know that they're air dried and not exposed, go for it. Grains are high in nutrients, but they're high in the glyphosates. If you're trying to avoid glyphosate, you want to avoid those things. Now, having said that, this is a ubiquitous chemical. It's in our water. It rains out of the sky in Iowa, they say. There's so much glyphosate. How are you going to offset that? Well, you're going to take supplements. Number one, you're going to spend time in sunlight. I've had a melanoma. I know you're scared. Sunlight, melanoma. I get it. Where I had my melanoma, the sun has never shone. Okay, I'm going to discount the melanoma is strictly sun related. Okay, sunlight without sunscreen will help your body naturally augment the vitamin D in your body. You can take a supplement. So when do you take the supplement? It's a fat soluble vitamin. You should take it with some manner of fat and understand that vitamin D can interfere with the melatonin production pathway if taken too close to bedtime. Take your vitamin D early in the day with some manner of fat in a meal, whether that's breakfast or lunch. Just make sure there's fat involved, and that vitamin D will absorb better. And then if you need melatonin, take that closer to nighttime. High doses of melatonin are used in functional medicine. It's a great anti-inflammatory. Again, during the COVID pandemic, a lot of people were treating long COVID type symptoms with high doses of melatonin, like 10 milligrams, sometimes even 20 milligrams. And you may want to talk to your physician if you want a high dose like that. But take your melatonin supplement at night. Get a nice clean diet, avoid blue light. All of these things interfere with your ability to sleep. And when you can't sleep properly, you're heading towards a medical disaster. If you're pregnant in particular, you've got to avoid these substances. You got to get your vitamin D, you got to get your melatonin, you got to get sunlight, and you have to avoid the blue lights. That way, the baby is going to have a better chance of being super healthy, born into a definite modern chemical world. All right, we'll see you guys next time.